Please join us while we take you on your journey to an active, pain-free lifestyle after total hip replacement surgery. This presentation will help you in understanding the fundamentals of total hip replacement surgery. It is an educational tool designed to answer some of the questions you may have. Thanks to all of the recent advances in total hip replacement surgery and our patient and family-centered care approach, we will make your recovery as anxiety-free, pain-free, and as rapid as possible for you and your family. Total hip replacement surgery is one of the most successful procedures in all of medicine. There is an increasing need for total hip replacement surgery as baby boomers age because the incidence of problems increases with age. Osteoarthritis alone disables approximately 10% of Americans age 60 and over and compromises the quality of life of more than 20 million people. So why live in pain due to hip arthritis? Let's begin with an overview of the hip. The picture you see is of a normal hip joint. There is one compartment of every hip. The hip consists of the femoral head or ball on top of the femur, the pelvic socket or acetabulum, and the labrum or cartilage. The cartilage is the precious material that covers the ends of bones and allows the joints to glide with virtually no friction. Notice that there is cartilage covering both the socket and the ball. As you can see from the picture, cartilage creates the soft surface between the femoral head and the socket. It acts to cushion the weight-bearing surfaces of the hip. When arthritis sets in, the cartilage between your joints begins to wear over time, and eventually the bone wears down too. This causes the inflammation and pain, which prevents you from maintaining your active lifestyle. Here is an example of the x-rays of a normal hip. As you can see, there are normal spaces between the femoral head and socket, representing cartilage. These are the x-rays of an arthritic hip, which show that the cartilage has completely worn away on the right side and there is raw bone rubbing on raw bone. This is what causes the intense pain and swelling associated with arthritis. As you can see from these x-rays, the gap between the ball and socket is completely gone. We prefer these x-rays be taken standing in a weight-bearing position so your physician can determine the amount of cartilage remaining in your hip. The first question you may have is, what is a total hip replacement? A total hip replacement involves replacing the cartilage, which is worn down between the femoral head and pelvic socket, with an implant that resurfaces the joint. During surgery, the femoral head is removed and a metal ball and stem is attached in its place. The pelvic socket is resurfaced to fit a metal liner, and the deteriorated cartilage is then replaced with a plastic or metal insert. The action in the hip of metal rubbing on plastic or metal alleviates the bone-on-bone grinding and relieves the pain. Our patient and family-centered care approach is unique in that it focuses on the needs of patients and their families. For instance, before your total hip replacement surgery, we require that you have a history and physical, blood work, and special testing to make sure your health is in tip-top shape. The great thing about our program is that patients are able to have all of their pre-testing done in one place in less than 2 hours of their time. We refer to this as one-stop shop. Testing day is your test day for you and your coach. During your one-stop shop, you will have a history and physical examination, lab work, EKG, urinalysis, and chest x-ray. We will also address any questions or concerns you may have if they are not already answered as we go through the whole process of a total hip replacement surgery, start to finish. Here at Renaissance Orthopedics, we have a special approach to total hip replacement surgery to make this experience as pleasant and anxiety-free as possible. We call our approach the patient and family-centered care approach. Patients choose to have total hip replacement surgery in order to regain a higher quality of life. But remember, surgery is only one part of a much larger process. The patient and family-centered care approach is designed to make the process as easy and pain-free as possible for patients and their families. We promote a positive experience and a successful outcome with our complete approach. In summary, we believe that the patient and family-centered care approach involves education and preparation, a less invasive surgical technique, special anesthesia and post-op pain management protocols, rapid rehab, and even minimal waiting because we value your time. We like to think of our special program as a hospital within a hospital. We have designed our own floor, which is tailored to meet the needs of total joint replacement patients. Even the physical therapy unit is on the same floor for your convenience. We also provide a spacious family area with refreshments and a massage chair. Patients even have room service available 24 hours a day. We strive to understand patients' needs from beginning to end with our team approach and focus on wellness. We make the process of total hip replacement surgery as pain-free and anxiety-free as possible. Due to our focus on wellness, patients are encouraged to get dressed in their exercise clothes daily. Our team encourages a wellness approach to recovery. One of the aspects of our program which makes it special is our rapid rehab protocols. During your hospital stay, you will take part in aggressive therapy twice a day, starting the night of surgery. Keep in mind, progress varies from person to person and largely depends on your effort. This is why it is important to work hard in physical therapy. You will be taught several exercises in physical therapy which will help in the recovery process. Once you are discharged to home, a physical therapist will come to your house every day for therapy. You will then start attending outpatient therapy. Remember, the speed of your recovery is up to you. The purpose of a total hip replacement is to get patients back to normal activities as soon as possible, and through hard work and a positive attitude, you will be on the quick road to recovery. Here are some general guidelines for you and your family which will help you get a better idea of what to expect after surgery. Our length of stay in the hospital is only between 1 to 3 days because you are full weight bearing the day of your surgery. In addition, 96% of patients are discharged directly to home with daily home therapy. Very few patients are transferred to a rehab facility because there are no restrictions from our standpoint as long as the knees are kept straight ahead or spread apart to prevent dislocation. The only other activity we tell patients not to do is jogging for exercise or other high-impact sports as they cause accelerated wear on the hip. Otherwise, patients are able to get back to full activities when they feel comfortable. Because patients work so hard in therapy while in the hospital, we have arranged for relaxation time too. Enjoy a relaxing massage prior to discharge, compliments of the orthopedic program. We also have a massage chair in the family room for family members to use at no charge. What is it about the craze for minimally invasive total hip replacement? The term minimally invasive is often misleading as it would be more accurate to describe the procedure as a less invasive approach. Basically, surgeons are using smaller incisions and less invasive techniques, but it is important to remember that the surgery itself is just one component of a successful total hip replacement. Here at Renaissance Orthopedics, we feel that the patient and family-centered care approach is what makes our program special. Patient and family-centered care, education and preparation, special anesthesia and post-op pain management protocols, and rapid rehab all contribute to making your total hip replacement experience as easy and pain-free as possible. In the orthopedic program, you and your coach become part of a dedicated team whose goal is to ensure you achieve the best possible results. By working together, we can have you walking the day of surgery, driving when you're on a cane, and back on the golf course. So overall, we found that we need a complete approach in order to speed your recovery and get you back to your active lifestyle as soon as possible. As with any surgery, there are potential adverse effects. Keep in mind the adverse effects are very rare and can be associated with any surgery. These include, but are not limited to, infection, bleeding, blood clots, heart or lung problems, nerve injury or blood vessel injury, fractures, stiffness, leg length discrepancy, and hip dislocation. As part of this process, we would like to educate you on what to expect after your total hip replacement. For example, after surgery, some patients experience a feeling that their legs are different lengths, called a leg length discrepancy. There are two types of leg length discrepancy, apparent and true. With apparent leg length discrepancy, the affected leg seems longer than the other leg, even though they are really the same length. This feeling can be due to muscle contractures, back problems, and knee or ankle deformities. In a true leg length discrepancy, one leg is actually longer than the other. Sometimes patients can have unequal leg lengths and never feel it. Sometimes the treatment for a leg length discrepancy after surgery is just waiting a few months after surgery while your muscles readjust. Patients also notice improvement with stretching and strengthening in the first 8 to 12 weeks after surgery. On occasion, patients will wear 1 or 2 Dr. Scholl's inserts while their muscles readjust. However, it is important to remember that the goal of treatment and size of the insert is always based on how you feel and not necessarily a specific measurement. Since you have decided to proceed with total hip replacement surgery, we would like to emphasize the importance of developing a therapeutic partnership between you and the doctor. The surgical outcome depends not only on the surgery itself, but also on your participation and the ability of your body to heal itself. We will work through any unexpected outcomes or issues together, but it is important to remember that there can be unexpected outcomes with any surgery. As you go through this experience, please feel free to share with us your feelings about the process. Remember, we will be there with you every step of the way to full recovery. We hope that this presentation has helped to give you a better understanding of both total hip replacement surgery and our special program. We will be happy to address any further questions or concerns you may have. You will also be provided with an educational folder which will address many of your questions. Thank you, and the best of luck to you on your journey to an active and pain-free lifestyle.